When I was 9 years old, I was diagnosed with diabetes. Overnight, my family and we had to relearn our way of living. And it was not the 10 daily insulin shots or glucose testings in my fingers that was the biggest problem. It was to learn about how food, play, stress, and feelings affects the blood sugar. Diabetes is an invisible disease, but it's a continuous fight inside the body to balance the sugar. And it's been an amazing development in both new technology and medications. So today, I don't need to take all my shots anymore. But still, the daily life challenges of diabetes are the same. And it took me about 15 years to become an expert on my body and how it functions. And it was such a relief to talk to other people with diabetes when I grew up, because they all had the same experience and they all felt alone as I did when I got my diabetes. So when I talked to others and we shared our experiences, that was when the idea of eDiabeat was born. eDiabeat is a support system for people with diabetes, both the patients and the family around. We have a global approach, and with interactive learning modules, following the latest guidelines, customized challenges targeting the specific needs of our users, goal tracking, and syncing of health data with wearables and apps. With social interaction and rewards, we make diabetes care more personalized and engaging. Patients use eDiabeat to get a better understanding of how their own body works and to meet others in the same situation. And this is patients at all ages and stages in their diabetes journey. They also get daily motivation and help with a sustainable behavioral change. Families use eDiabeat to get more knowledge about diabetes and to feel more safe. We use a secure IT platform that has proven results in both engagement and behavior change since 2001. And here is a sneak peek of how our solution looks like. Only in Europe, we have almost 60 million people affected by diabetes, and I bet all of you here know someone affected by diabetes. World Health Organization states that diabetes is one of the biggest threats for humanity because it's escalating in the world right now. Bad controlled diabetes leads to more emergency visits, increased number of sick leaves, and also premature death. And despite these health issues and lower quality of life, diabetes accounted for 100 million euro in healthcare expenditures last year, only in Europe. Most market players today are focusing only on the patients and that they should track everything they do from morning to night. Track. Our approach is to build a customized experience for the user. And it doesn't matter if you're the patient or if you are a family member or partner. And that's what makes us unique.
We have a strong core team with international experience. My name is Annika, and I have my academic background in behavioral science, specialized in behavioral change. Before eDiabeat, I was been running my own business for 10 years, focusing on medical education. Richard has a master in business from both Singapore and from Sweden, and he's been working in the life science area as a project manager in US and in Germany. Then we have Martin. He's a serial entrepreneur developing IT solutions, and he's been doing this for the last 15 years. Hans, MD and PhD in immunology. He meets diabetes patients every day who are not focusing on their diet or physical activity recommendations. For a state of the art, we collaborate with the diabetes experts, with patient federations, and also with the healthcare providers.
We've been working with eDiabeat since February, and it's happened a lot during this time. We won Venture Cup, that's the biggest business ID competition in Scandinavia. The next step for us is just in time for the World Diabetes Day. We'll release our first beta targeting families with diabetes, type 1 diabetes. The next step is to do a user study at 3 diabetes clinics in Sweden. Our vision is to help people with diabetes and improve their health all over the world. So Sweden is just a proof of concept. Our business model is two-parted. Firstly, we sell monthly subscriptions directly to family members and patients whom we target through patient federations and online marketing. We also do licensing deals with strategic partners such as insurance companies and healthcare providers who then distribute the licenses to the patients. Pharma companies can also use eDiabeat to recruit patients to clinical trials and market surveys. Lastly, patients can choose to share their own personal health data for diabetes research. This year, we are only focusing on development and user traction, so we will have no revenue, but next year we will be active in 2 countries at least. By 2017, we aim for 100,000 users in 8 countries, and we will use the profit to grow organically and also contribute to diabetes research worldwide. eDiabeat leads to better health outcomes, higher quality of life, and less cost for society. Help us, helping others, help themselves. It shouldn't take 15 years for anyone like it did for me. Thank you for your attention. Now we're happy to answer your questions.